Ladies, did you know that understanding this kind of discharge that you may get in your underwear at certain times of the month can help you fall pregnant faster? You want to know how? Keep watching. Hi, I'm Dr. Kady. I'm a certified family doctor. Welcome to this channel where we address health topics, but more specifically, we hone in on women's health and fertility medicine. You see that discharge that I earlier illustrated? Well, it was to represent cervical mucus, which plays a significant role in the process of conception and fertility. It is a fluid that's produced by the cervix, which forms the entrance to the uterus, but the characteristics of this fluid changes throughout the menstrual cycle. And this is in response to the hormonal fluctuations that happen throughout a woman's menstrual cycle. So if you're trying to fall pregnant, it is absolutely imperative and of value for you to understand the changes in the characteristics of this cervical mucus. Here are two key elements for you to understand about cervical mucus. The first is that you can use the texture and consistency of the cervical mucus that you see coming out into your underwear as a fertility indicator. Let me explain. If you are a woman of childbearing age, and that simply means that you are a person or woman who has started to have monthly periods, even if they are irregular, you would have noticed that the discharge that you see in your underwear changes in consistency and appearance throughout your menstrual cycle. Around the time of ovulation, which is when your ovaries release the egg into your fallopian tubes, the cervical mucus or the discharge you start to experience in your underwear becomes more abundant, more slippery, wet, and very stretchy. It also will have a clearish, almost transparent appearance. Put simply, it will resemble the texture of raw egg white. Remember, there are fluctuations in the various hormones during a woman's menstrual cycle. But the main hormone that influences cervical mucus is estrogen. Estrogen gradually rises and is at its peak closer to ovulation. Estrogen not only increases the amount of cervical mucus that is produced, but also ensures that the mucus has a more liquidified texture, which is the ideal environment for sperm cells to swim through. Estrogen helps to soften the cervix and opens it up ever so slightly, again making it easier for the sperm cells to swim through. This type of cervical mucus is ideal for fertility. And so when you see this type of discharge in your underwear, also referred to as the egg white cervical mucus, it's time for you to have intercourse. Having sex during the period where you're seeing this type of cervical mucus in your underwear increases your chances of falling pregnant. And all you would have done is to use your cervical mucus as an indicator for your fertile window. Granted, you may also need to use other tools like the ovulation kit, but knowing the texture and the consistency of your cervical mucus can give you additional help and further increase your chances of falling pregnant. The second element that has to do with cervical mucus when we're talking about fertility is the fact that this egg white cervical mucus supports sperm transport. This type of egg white cervical mucus provides an optimal environment for sperm cells' survival and motility. It also facilitates the journey of the sperm cells through the cervix into the uterus. So it's safe to say that your cervical mucus being in the egg white-like state, it increases the chance of the sperm cell reaching the egg in the fallopian tube and for fertilization to happen. But 24 to 48 hours after you have ovulated, the texture of the cervical mucus changes. It becomes thicker, more dry, and sometimes can look a little bit white. At that stage, there is a reduced amount of cervical mucus being produced. This is due to the impact that the hormone known as progesterone has on cervical mucus. After you have ovulated, progesterone gradually rises, and it causes the cervical mucus to actually form a mucus plug, otherwise known as a cervical mucus plug, which sits right at the entrance of the cervix. So the cervical mucus being in this very thick and dry state will make it very difficult for the sperm cells to swim through the cervix and into your uterus. So that means that when you see that your cervical mucus is in that state, it may be harder for you to fall pregnant. although not completely impossible. Without the influence of progesterone, which naturally changes the texture of your cervical mucus, depending on where you are at in your menstrual cycle, there are things that can negatively impact your cervical mucus in its fertile state. That means that even when it's supposed to be in the egg white consistency state, which is supposed to be during your fertile window, there are things that can negatively impact that cervical mucus in that fertile state. The first is dehydration. If you're not well hydrated, there will be a reduced amount of cervical mucus being produced. And any cervical mucus that is produced may not be as stretchy, as slippery, and as easy for the sperm cells to swim through, because your body will divert any hydration that you have to more vital organs like the kidney. So when you are dehydrated, the state of your cervical mucus is the least of your body's priority. So make sure that you're keeping well hydrated. Certain medications like antihistamines and decongestant have a drying effect on the mucous membranes all over the body, including in the cervix. So with this drying effect, it will reduce the amount of cervical mucus that is being produced. And remember, this egg white consistency type of cervical mucus is needed to support sperm survival and motility. So what should you do if you really need those drugs for other areas of your health? Should you stop taking it because you're trying to fall pregnant? Look guys, that's not at all what I'm saying. Have a discussion with your doctor. Remember, cervical mucus is just one element of the grand scheme of things in terms of the process needed for you to fall pregnant. Cervical mucus and it being in the right state just helps to add to all the other elements that are necessary for you to fall pregnant. Remember, the two main and most important thing that has to happen in order for you to fall pregnant is you must be ovulating, and a sperm cell, a good and healthy sperm cell, must meet the egg in order for fertilization to happen. Cervical mucus is one element which, if you understand, can help facilitate you falling pregnant faster. It's not the end and be all. There is hormonal imbalance, such as the irregularity in the estrogen that is seen with patients with PCOS. In PCOS patients, the irregular peaks and troughs that is seen with estrogen has an impact on the cervical mucus. It affects the quality of this egg white cervical mucus that we like to see in the fertile state. It also affects the quantity. So not having enough estrogen means that you may not be producing enough of this cervical mucus in the fertile state. Contraceptions, more specifically the combined oral contraceptive pill and the progesterone only pill, change the characteristics of the cervical mucus. It causes the cervical mucus to become more of a cervical plug, where it's very thick and dry and harder for sperm cells to swim through. Then we have sexually transmitted infection, bacterial vaginosis, and stress, which all also negatively impact the cervical mucus in its fertile state. So some people have asked the question, well, doctor, if I'm not producing enough cervical mucus in its fertile state, can I use a lubricant as a substitute for this cervical mucus that I'm not producing enough of? What I will say is that the use of a lubricant is never going to be a good enough substitute for a healthy and abundant cervical mucus that your own body produces. So as I've just gone through a list of the things that can negatively impact your cervical mucus in its fertile state, and you make sure that you address all of them, there should be no reason why your body wouldn't be able to produce enough cervical mucus on its own. But look, I'm not completely knocking the use of lubricant. It can be a good thing. It can help with further lubrication. It can help increase lubrication, especially when you're feeling a little bit dry down below. Some companies have developed lubricant formulation that help to support sperm transport, motility, and survival. So it's not all a bad thing, but if you're going to use lubricant, make sure that you have done all that you can to be able to produce healthy cervical mucus by yourself, and you're not doing anything that will negatively impact your ability to produce cervical mucus. And when you need a little bit more help, be very selective and do your research over the lubricant that you choose to use. I can appreciate that trying to conceive can be a very stressful time and challenging as well as emotionally draining, especially for those who have been trying for many years. As a Christian doctor, I always want to make sure that I'm leaving you with a word of hope in order to build your faith, even as you wait for God to bless you with a child or even children. Therefore, today I'll be sharing from Isaiah chapter 41, verse 11. All who rage against you will surely be ashamed and disgraced. Those who oppose you will be as nothing and perish. I pray that you find encouragement in God's word. I'm praying for you. Keep strong, and we'll see you in our next video.